the Institute of Sports and Spines. Today we're doing part of our video podcast answering some questions that patients have. So we had a question from Natalie about a glute medius injury. Glute medius is a muscle that essentially goes from your hip and pelvis to the back of the leg bone, the femur, and it helps with external rotation of the hip and it helps with the tilting function of the pelvis. Now, it's a very commonly injured muscle but often misdiagnosed. So if someone has a labrum issue or a hip issue, as in they need a hip replacement, then the glute medius will be involved. If you have SI injuries, sacroiliac joint through here, the glute medius will have a role in managing or controlling what the hip and the SI joint will do. So injuries are very common. There's lots of different strategies that can be used to manage glute dysfunction, and commonly just soft tissue work, massage, different release techniques, sometimes acupuncture can be helpful. If they fail to have an impact, then you can move on to things like shockwave therapy and different more aggressive interventions beyond that would go to like injection therapies, cortisone injections, etc. Sometimes people have some surgery if it's become completely detached, have surgery to reattach the tendon, and certainly post-op rehab is a critical component in managing this, and as people get through the acute phase, then you want to re-strengthen the area again. So if something's been giving you a lot of trouble for a long period of time, say post-surgery, it can be applicable to get some more imaging done, work out whether that has actually had the benefit or the effect that the surgery is intended to do, or whether there's a secondary complication, because sometimes you'll have an injury that appears to have been resolved with surgery but something else has come up, or it's developed a tendonitis, or there may be a secondary tear or something that's developed. Sometimes there can be scar tissue or calcification that can occur, and that can stop a good resolution. So certainly if it's something that's still giving you trouble, it'd be good to give it a thorough examination and potentially look at some imaging to fully investigate and then work out a better treatment solution beyond that.
Hi there, Emily Holzberger here from Institute of Sports and Spines, continuing on with our video series. So we had a great question from Sam asking about foam rolling techniques for the upper limb and the lower limb. So we don't have time to go through all the different foam rolling exercises for our upper and lower limb. So today I'll just be demonstrating the technique that we want to be using for most of our foam rolling exercises. So I'm going to be foam rolling my calves today. I'm going to straighten my legs out, cross one leg over the other. I'm focusing most of my weight on my left-hand side. So I'm starting from the insertion point of the muscle up below the base of the knee here, lifting my body weight up, slowly coming down to the base of my ankle, and then going back the other direction. So really important when we foam roll that we are moving nice and slowly. A lot of people move much too quick, and we're not really going to achieve the muscle relaxation if we do it that way. We want to make sure that we're not actually crossing over the joint line. So if we don't really foam roll our joints per se, it's not going to have a good result. We can put a bit too much pressure on the joint there. For some exercises you might be putting the foam roller on your spine, but with that one we do recommend that you get some coaching rather than just giving it a crack at home. So that's really important that we move nice and slowly, we're not crossing over the joint lines. Sometimes foam rolling can be very painful if the muscles are stiff or sore. So you might want to use another technique so we're not putting as much load on. So for example, for my calf, I'll just straighten my leg out and just give myself a bit of support with my other support leg there to take my body weight off that left leg a touch. So foam rolling is one release technique here. We do use it a little bit at Institute of Sports and Spines. We find that it works for some clients, but not everyone. We're all individual and have different techniques that work better for releasing our muscles off and reducing pain. So we do always recommend that you come in, get an assessment, and then your therapist can let you know what the best release technique is for you. Thanks.
Hi everyone, Max here from the Institute of Sports and Spines. Today I want to talk to you about the nutrition composition software that I utilise when dealing with clients' individual food requests or when meal planning. So I use a program called FoodWorks, which is based on Xyrus software. So it's an Australian company influenced by the Australian food composition database, as well as some food allergy experts from across Australia. It's a program utilised in nearly every single hospital in Australia and loads of universities, private practice, and here at the Institute of Sports and Spines. So what this program allows me to do is broadly look at an individual's dietary intake over the course of a day, a week, a month, and look at the macronutrient and micronutrient distribution. It allows me to help identify any deficiencies or something an individual is over-consuming, under-consuming, so that I can adjust planning as necessary to fit in with their goals and give them the best, most optimal experience regarding their meal planning.
Hey, Luke Atkins here from the Institute of Sports and Spines. Today we'll be talking about a question we got asked involving pillows and what the best pillow is for helping with morning neck stiffness. So here at the Institute of Sports and Spines we sell pillows that are contoured, either latex or memory foam, and we fit them to you. So when I say we fit them to you, we look at the height between your shoulders and your neck and look at the alignment as well, so making sure the nose is in line with your sternum. So in looking at that, little pillows like this, having 1, 2, 3 even, can make your neck really stiff in the morning. So having one bad pillow and laying down on it can make your neck fall downwards, allowing the muscles down here to contract and stay that way, hence waking up and getting a sore neck. The other way is having 2 pillows and making it too high, hence having your neck end up in a crooked position and getting a stiff neck the other way. So when we're testing and fitting people, what we do is we get them to lie down on a mattress like what I'm doing now, and allowing the pillow to sit down, the contour, making sure that it's fitting really nicely into the neck groove, and allowing the head to fall flat and relax, allowing the nose to stay in line with the sternum. And then if, depending on the type of sleeper you are, whether you're a side sleeper or a back sleeper, we can also look at you lying on your back and allowing the contoured pillow to fall in line with the curvature of your neck and looking at how it's affecting you posturally.
Done again, continuing a video series. We had a question from Dean in regards to old man calves. So calf injuries are certainly something that can be a prevalent injury among runners, particularly distance runners. Some of that can be due to overload, and one of the first questions we would always have is whether the shoes are appropriate or not. If someone had shoes that were too cushioned and too soft and they had very flat pronating feet, generally speaking it's not a good combination. Secondarily, if they had very rigid supportive shoes and they had very rigid high arched feet, it's once again not a good combination. Either of those two combinations can lead to injuries. However, there's another few different things that we see quite commonly. There's been a prevalence over the last 5 to 10 years of people moving towards 4-foot running or 4-foot striking when they run. And there's pros and cons, and we're not going to argue about that specifically today. However, what I would say is if you're trying to work into 4-foot running, if you do progress too quickly, there's a very good chance that you're going to overload your calves and get calf injuries as a result. So most injuries of tendons and muscles in the body are a load issue. People are pushing too much load too quickly, they're starting to run too many miles too quickly, and they're not giving the body time to adapt. So when we look at adaptation curves, muscle adapts relatively quickly. We can start increasing strength in 4 to 6 weeks from starting a new strength training program. The tendons and ligaments are a different story. They take substantially longer. So if you accelerate your training too quickly, then often you develop too much strength, then the other structures cannot deal with that increase in strength, and so people get injuries. As we age, our healing rates reduce or slow. So we're at a high risk of injury. So we need to be more mindful about the acceleration in our curve of training. And the other thing we need to think of is sometimes we can get some vascular insults or reductions in flow that mean the muscles are not getting the blood supply they require. Now in the calf particularly, popliteal vein, artery and muscle go behind the knee. For some people they'll get little strictures that will restrict blood flow in the popliteal artery, which means that the general blood flow into the lower leg, and the calf particularly, can be compromised. It can be a very common reason for calf injuries in middle-aged men. It's particularly notable if you've had previous injuries in the calf or tears that have got scar tissue formation. The scar tissue then is essentially entrapping that blood vessel that causes the reduction in flow that then lets them injure the calf more easily. We've seen a number of cases like this that have been misdiagnosed and mismanaged for a number of years. When you investigate and look at MR studies, you can see the restrictions. It's a bit of a complex one because generally it's a vascular surgeon required to open up that stricture, but it can be something that would be a causative factor in what someone would just call old man syndrome or old man calves, where they've actually got a previous injury that reduces blood flow. Second thing is, if you've got scar tissue there, then maybe we want to break up that scar tissue so that the calf functions more normally again. So we'd use a range of different techniques to do that, sometimes dry needle and acupuncture techniques, sometimes stretches, sometimes we would use essentially ART or muscle release techniques to improve the length and pliability of the muscles, but at the same time we'd always want to assess the foot biomechanics, the gait biomechanics, and ensure that the calf and the foot mechanics are being supported appropriately by the right footwear. So I hope that gives you a couple of tips and pointers you can think about, and hopefully that helps.
Hi, it's Maxie from the Institute of Sports and Spines. Had a really good question from one of our clients, Bob, who came in earlier this week and asked if a low-carb diet was the superior weight loss strategy. And rather than just giving him a yes or no answer, I thought I'd make a video for our video series to explain it a bit more. In regards to weight loss, it doesn't necessarily matter what macronutrient we're influencing, whether it's increased or decreased across the broad spectrum of daily eating or across the week. It's more the calories or that energy, the kilojoules that we're consuming, which is the main influencing factor at the end of the day. Whether you're high carb, high fat, low fat, protein is something I don't really consider to be overly important in regards to adjusting in a diet for weight loss, as the body can only utilise so much every couple of hours, so it's a far superior option to influence either carbs or fat. But in the grand scheme of things, in regards to weight loss, is the overall calories consumed in a day that is the most thing, with a major focus on energy expenditure, so calories out. And it's really, really important to be in a calorie deficit to ensure that weight loss is achieved.
Hey, Luke here again from the Institute of Sports and Spines. Another question that we got asked with our poll is whether we recommend shoulder back braces for postural correction, or is it better to do exercises and be more mindful? We, as practitioners, are not a fan of back braces. This is due to the posture being on a subconscious level of the mind itself. So giving exercises to a patient will work long term and be more effective with introducing things into the subconscious mind and allowing it to become more corrected in the posture, so allowing the patient to not sit so slouched but allow it to come up more upright. Okay, with a back brace it may make you feel more upright, but what they can tend to do is just pull the shoulders back and allowing the neck to still stay forward in this swan-like fashion. Okay, so here we tend to do an assessment and then give individual exercises that can help benefit different postural corrections over different periods of time. So if this is something that you're having trouble with, by all means come in, get assessed by one of our practitioners here and get given some exercises that can help.
Continuing our video podcast, we had a question from Carla in regards to neck stretches and neck pain. So at the moment we're seeing a massive amount of neck and upper back problems associated with people sitting at their desk at home when they're working from home due to COVID-19. So unfortunately lots of people are working on a laptop or they're working at the dining table on a dining chair, and it's really not an appropriate ergonomic environment. So things we say definitely should look at: if you're working on a laptop at home, it's not possible to achieve good ergonomics without at least an external mouse and keyboard. So we'd like to see you put the keyboard up on something. A stand is brilliant, but a few books would help to bring it up so the top of the screen is about eye level, and a mouse and keyboard so you can bring them into this position so you sit comfortably. So do that, get a good office chair or bring a chair home from your office at work that hopefully is an effective ergonomic chair anyway. and we can start having a decent environment at least. Now, if your neck still stays sore, a couple of simple stretches you can do for the scalenes and levator scap and upper trap muscles. I normally suggest sitting on the hand, so if I'm going to stretch the right hand side, I'll sit on my right hand, and if I drop my left ear to my left shoulder, bring my left hand up and rest it on my right ear and just let the arm weight fall sideways. And then as a resistor stretch, I can lift the head up into the hand, gently pulling, then breathe in, breathe out, relax, and let it sink further. So that's a simple scalene stretch. We can bias the stretch towards the posterior scalenes by dropping our chin a little bit and still the sideways pressure, or we can lift the chin up a little bit, looking towards the ceiling, and that'll bring it into the anterior scalenes. If we want to move to the upper trap, we can, it's often called listening to your armpit. So we turn our head 45 degrees to the right and drop our ear into our left armpit. Let that hand rest on the ear and gently let the arm fall forward at about a 45-degree angle. From this position, same thing, we can lift up gently and resist, breathe in, breathe out, relax, and let it sink. Don't pull the head down, you're just letting it slowly slump forward. The last simple one is called smell your armpit for levator scap. So we stick our nose right down in the armpit, make sure you use some deodorant, hand on the back of the head, let the elbow fall forward, once again at that 45-degree angle. We lift up, breathe in, breathe out, sink forward. The last thing I'd encourage you to think about, when you're sitting, ears, shoulders, hips should be in a nice straight line. So if you're tending to do this, think about sitting up tall, tucking your chin in, pulling your head back so your ears are in line with the shoulder and the hip, and that should be a more appropriate ergonomic position for posture.
Hi there, Max again from the Institute of Sports and Spines. Another topic I want to be talking about regarding weight loss is a study that came out of the Australian Institute of Sports at the AIS in 2014, where they did a study looking at a comparison between high intensity interval training and submaximal threshold training in regards to energy expenditure and overall fat loss. So what they were looking at in that HIIT group was obviously high intensity, low intensity, high intensity, low intensity versus the sub-threshold, where they were getting a lactate reading of as close as possible to an individual's lactate threshold. And over a 30 to 45 minute period, the lactate group achieved the greatest amount of weight and fat loss in comparison to the HIIT training. So sustained high intensity training, sustained being the key word, over that period of time yielded the greatest results in comparison to lactate going up and down regarding the